infections are acquired, because there you have something in between. You're supposed to render high intensity care without the infrastructure, neither the staff. So that is where the large gap exists and where the infections go in. And incidentally, this hospital treats a lot of immunocompromised patients, not only HIV, which are earmarked. We have got chronic renal failure patients who are coming in with immunocompromisation. We have got transplant cases coming in, and we have oncology cases who are also immunocompromised due to the therapeutic procedures that are followed. So there is a very large segment of patients here who are potentially targets of fungal infection or mycotic infections. So I would suggest that if you could cast some more light on this, and the presentations and what are the specific investigations for pinpointing the typical type of organism that is invading, because otherwise even after 5 days of treatment with antifungal we do not get the result, and then we have to change over to some other drug. So that could be a little more help to all of us here. And to the sisters who have undergone the training, I'm sure you have learned a lot of things. You have to use them when you go back to your workplaces. But to begin with, your workplaces may not be as well equipped as here at Garden Reach. The ICU here or the CV clinic here are something, I suppose, much better equipped than the divisional setups either in Agra or CKP. Kharagpur I have not been lately, but I think still there is little less preparedness at Kharagpur. But nevertheless, if you have the knowledge and the basic infrastructure, you can do wonders. You can put a patient on a ventilator, on a bird's ventilator, way back, 20 years back at Kharagpur North Block, and save the life of the patient. You can revive a patient of electrocution with intubation and ventilation and shift the patient to Bokaro General Hospital at Agra Casualty. It can be done if you have the know-how, the knowledge, the technique. And I would suggest to Dr. Jha that in addition to his cardiology treatment, I think a little bit of resuscitation of the respiratory system should be included in this training, because at the point of time of acute MI, sometimes patients do go into respiratory failure, and timely intervention can make the difference between life and death. So I think that can be included and suggested, because unfortunately none of the divisions except Kharagpur have got regular anesthesiologists who can subsequently continue with their intubation training. But I think it would not be bad if you could pick up the ways of securing the airway and imparting IPPV to these patients who are very sick. I wish you all the best for your future, so that you can utilize your knowledge that you have acquired here. And last Saturday we had a meeting